Yeah, so I had the privilege of giving the next talk. For those of you that don't know me, I'm Claudio Friel. I'm an assistant professor at the Sargent College of Health and Rehabilitation Sciences at Boston University. I officially worked in Kathleen's lab starting in 2015 to 2019, but we've run in the same research circles since about 2009 when I was a PhD student in Andy Gordon's lab. So it's always a little strange to read this prompt about myself, but Kathleen got the question, what made you excited to mentor this person? And she said, I'd gotten to know Claudio when he was a doctoral student in Andy Gordon's lab. He not only showed expertise in what he was doing, he really seemed to enjoy it. I knew and was correct that he would bring his enthusiasm of learning to our lab. And so thanks for those kind words. Great. So, like I said, it's a real privilege to get to share some of the experiences that I've had in Kathleen's lab and some of the threads that we're pursuing in my lab currently. And I hope to share some of the work that I'm doing in my own lab because I hope that you can see some of the threads that kind of weave together with Kathleen's career and the large body of work that preceded that. It's also special to share these ideas now because some of these ideas were just kind of bouncing around in my head when I was a postdoc in Kathleen's lab. And so even though they weren't really fully fleshed out, Kathleen was always very encouraging and helped me bring a lot of focus to my science and the questions that I was asking. So I'd like to just start with some of the themes that guide the work that we do. We're particularly interested in understanding factors that contribute to variability and the impairments that we see in children with CP, and using knowledge of mechanism to inform novel therapies. And then also really thinking about development as a tool to really understand the natural history of disorders and identifying therapeutic targets. And so, a lot of times we kind of are very quick to think about developing new interventions without really fully understanding sort of the ins and outs of whatever disease or disability that they're actually interested in studying. And when I was doing my postdoc in Kathleen's work, we did a variety of studies, and I collaborated on these studies with other people in Kathleen's lab, trying to determine some of the individual characteristics that account for the variability that we see in impairments in children with CP. And so we've looked at different structural deficits and changes that happen in the whole brain, really, as a response to this early perinatal or prenatal injury, looking at white matter integrity and how that relates to hand function. Work that was done by Disha Gupta in collaboration with Jason Carmel and Andy and Kathleen, looking at the role of sensory function and its relation to impairments that we see in children with CP, and obviously looking at motor pathway connectivity using non-invasive brain stimulation as a diagnostic tool to help kind of inform our understanding of the reorganization that happens in children with CP. I got exposure to a lot of really incredible new tools during my training with Kathleen. But I think one of the things that was always sort of a passion project of mine was sort of understanding what's happening much earlier in development. And we know that the infant brain is not an adult brain. There's qualitatively different aspects in which the infant brain operates. And so one of the themes that we're pursuing in my lab is how does sensory feedback provided by spontaneous movements set the stage for subsequent cortical control. And so these are babies between the ages of 2 to 6 months of age. For anyone that knows anything about infant motor development, this is a period that's kind of defined as like pre-skill, right? So it's just a period where infants are just engaging in a lot of spontaneous movements. But what's really interesting about these movements is that they provide a rich sort of source of sensory feedback. So the baby's learning about how the limbs exist in space, how the limbs exist with respect to one another, and they're also plentiful. So it's a rich kind of way for the baby to learn about how they can control their limbs. And importantly, at this stage, they're often subcortically generated. And so in some ways, we think about this as like providing the foundation for later M1 development or motor control to take over. And so to study sort of brain behavior relationships in this population, we've been using a tool known as functional near infrared spectroscopy. It's a mouthful, but basically we're using light to measure brain activity. And so we can basically take advantage of the properties of neurovascular coupling. The brain has a rich network of blood vessels. And anytime there's neural activity, you see alterations in local perfusion, and we can capture that using infrared light. But most importantly, it's an infant-friendly tool. And so these are students in my lab putting on an F-Ears cap on a baby. It looks very much like an EEG cap. Each one of these are sources and detectors of light. And importantly, it's robust with respect to movements. And it's a nice tool for studying sort of dynamic, real-world ecological movements in relation to brain activity. And we also have the advantage that infant schools are really thin, and so we get pretty good signal. In full transparency, this is probably one of the most calm babies, and of course I picked that. And with a very simple probe, we can actually, because the infant's head is so small, we get really good coverage of different brain areas that we're interested in. And so this is what our setup looks like. Again, we're really interested in understanding these movements that are dynamic, multisensory, and occurring kind of in real time. And so you probably can't tell, but the infant's actually also wearing some wearable sensors. And so we're able to sync the movements that are happening in real time, these very kind of precise quantitative measurements with signals that we're actually capturing from the brain. And I won't go into too much of the details here, but by as early as 5 months of age, we can reliably pick up contralateral activation. And so this heat map is cortical activity set to the onset of movement. So that dashed line is the onset of movement. And so by 5 months of age, we're already seeing contralateral activity. So these are movement bouts of the right upper limb, and we're capturing signal in the left hemisphere. And again, there's variability in the intensity and timing of these activation channels, but it's kind of a really interesting tool to be able to capture what's happening in real time and kind of inform sort of our understanding about brain behavior relationships during early development. We're also building on this early work. So one of the things that we find is that infants will cooperate up to a certain point, and then they start rolling over and no longer want to, share supine movements with us. And so we're also tracking basically skilled movements that emerge, from the period of 6 to 12 months, and now even beyond, and particularly looking at things like reach to grasp, unimanual manipulation, and bimanual manipulation. And looking at F-Ears activity in real time in relation to these different emerging skills, which, they kind of change and fluctuate throughout the course of development. And, ultimately by 24 months of age, these bimanual skills are really kind of taking up the majority of the infant's motor repertoire. So it kind of provides us with a nice snapshot of real-time development. So I won't go into this as well, but, same thing, we're able to identify contralateral activity in these typically developing infants. And our next step is to actually apply this with a clinical population of children who are at risk for CP or who have been diagnosed with CP. And so really we want to use information about motor development and brain plasticity to develop new therapies. So trying to understand when these areas become active, what are the types and frequency of movements that promote activity-dependent development of cortical areas, and how we might, one day potentially target those brain areas or adaptive areas, other areas that may potentially contribute, to adaptive plasticity using things like contingent non-invasive brain stimulation. So that's sort of the science. And I kind of just want to end with a few life lessons, things that kind of happen, outside the walls of our studies. And I think one of the things that I've appreciated, and I'm sure you've heard from many other of, the folks in this room, is that Kathleen has always encouraged us to, find our community and be active and be partners in the community, especially with the populations that we're working with. And so my lab has been very busy attending outreach, and coming to things like CP Soccer New England, which is, a great organization that provides opportunities for children with cerebral palsy to just kind of engage and participate and have fun playing soccer. So it's been a real privilege to be able to help out and really get to be partners in terms of relationships that are broader than just sort of research studies. She's also encouraged us to always surround ourselves with hardworking, fun, and passionate people, and so that things really fall in place. And I really feel that's true. And so this is just a snapshot of some of the folks that I've worked with over the years in my lab, and Andy and Kathleen's lab. And so I'm really grateful for all the relationships I developed during my time in Kathleen's lab. And I want to just end with probably the most important lesson that I've learned for Kathleen, and that's to give everyone a voice and listen to what they have to say. And so usually we know when you probably have heard Kathleen say this before, but a lot of times it's in the context of developmental or sort of disability, right? But it kind of extends beyond that. Kathleen has always, given us the feeling that there's food at the table for everyone and really encourage everyone to share their ideas. And so as a first generation student, when I was entering the world of rehab research, I was a little apprehensive because I really didn't talk or look like a lot of people that I was like meeting at conferences. And so, for the first moment, Kathleen always listened very intently to what I had to say and made me feel like I belong. And so this is a poster I did back in 2016 when I was in her lab. And then, it's a nice contrast to, this poster that I just did back in 2024, no longer in Kathleen's lab, but she made sure to stop by, ask me questions about my poster, and probably most importantly, ended our conversation with saying, "That's so cool." And for me, that's enough motivation to continue doing, what we do and do it passionately. And so I'm grateful for all the lessons that you taught us, Kathleen. So thankful for to my lab and also to Kathleen. So. Thank you so much. Thanks.